I have done 12 dental implants, 6 upper and 6 down. My front teeth was loose and up out. I was covering with a mask. The condition of my teeth were not really good. It was 20 teeth, 9 up and 11 downs, and a little bit hurting, and there was a lot of infection. And the whole procedure was painless. There was no any issue. When I have seen one dentist in Australia, he told me no one can put the fixed implant in your jaw because you need a dentures only. He told me not possible, only denture. Now I'm going back. I want to show him this is a permanent implant done by Dr. Cheema. So now I can eat easily apple, dry fruit. So when he was putting the implants, there was no any single pain. I was eating the food properly. This is the health job, and I'm working health department in Australia. When I check everything, then I decided to go with Dr. Cheema. I have discussed with more than 40-50 doctors, 40-50 dentists. My family members are dentists. Very good results, and they were professional. I didn't find any infection. I didn't find any swelling. Everything is comfortable. No any single infection. No. He done the full mouth 2 weeks ago. He fixed all the teeth. No any pain, no any problem. I'm eating perfectly, speaking perfectly. Teeth are very important for your life. They use very good, nicely infection control policy here when he done his procedure, and it was very difficult. Doctor take a challenge, doctor take a risk, but his hands are magic. I can eat, I can chew. I'm feeling very natural. I'm not feeling any pain. Everything is normal as it is. When he was expecting putting implants, I was going home and I was eating the food. My mom was really surprised. How are you eating? Because you're coming from the doctor. I said, yes, immediately after session. My tongue was normal in behavior. In my case, I have a blood pressure. My blood pressure was high. No complication, no extra bleeding, no any pain, no any infection, no any complication. I can sleep easily in the night without any pain.
3D implant planning software, and we do all in 3D. 3D surgery, everything in 3D.
3D scan is the best benefit.
Extracted your remaining natural teeth, which were not in very good shape. Placed 12 implants total.
Yes.
6 in upper jaw, 6 in lower jaw.
Yes.
And permanent teeth. It is immediate loading. So all done in only one visit to India and only in few days.
Only one visit is enough. Looking wise, it's very hard to sit in the public without if your teeth are not good. You will feel socially isolated. Your impression is more important. Cost will come back when you will smile in public.
Diabetes is not a problem, sir. Yeah. Hypertension is not a problem.
Regarding the payment wise, very flexible. Appointment wise, very flexible. If you have more than one question, million question, he is happy to give the answer. So I will request to the people, if you really want to enjoy your food and if you have few teeth, come to Dr. Cheema in Jalandhar and enjoy your rest of life. So I really appreciate, I'm really thankful to Dr. Cheema and Mrs. Cheema as well. Everyone, I'm Harish from Australia. Basically, I was looking for the treatment of my teeth. I was looking permanent implants, and I have seen, I have done a lot of survey in North India, who is the best doctor to do the implants. And basically, the condition of my teeth were not really good. It was 20 teeth, 9 up and 11 downs, and a little bit hurting, and there was a lot of infection. And then my family members are doctors. I consulted with them, but finally I found Dr. Cheema in Jalandhar, and I saw his reviews, I checked videos, plus I contacted him, and I came here and I consulted with him. The same day he told me to go for cbct. I have done, and he has a very good structural plan, and he used his qualification, skills and knowledge when he done his procedure, and it was very difficult, and the whole procedure was painless. There was no any issue. Secondly, the follow-up is very good. Like all the time staff call like every half an hour, 1 hour, how your condition when they send you at home. That is really fantastic. I like it, so that like they are more responsible, and their guidance, their judgment, very nice. In addition, I have noticed like according to the Western country, the infection control policy, they use very good, nicely infection control policy here. Use the new gloves, everything fantastic. No any dust, no any second thing. They are using a professional in manner they have used. Secondly, Dr. Cheema's wife, Mrs. Cheema, she was in the team as well, and even doctor take a challenge, doctor take a risk, but his hands are magic. When I was sitting the first sitting and he took only one truth, then I told him your hands are magic, and he has a great knowledge and he take the risk, and plus he has a good leadership skill and management skill. In the first day he took 3 on the door, and next after 1 day he took 7. Then I was really surprised. My family was surprised, like how a doctor took 7. It was really hard. I said, no, there's no any pain. I was really fine. The other thing regarding the payment wise, very flexible. I was really surprised, especially in India. No doctor will allow you. They always said, put the money first, then we'll start the treatment. It's very flexible. I really like it. And I hope so. This is my first and last surgery. And I advise why the staff members are on regular basis, what you have to do. They always check any pain, how you feeling. Appointment wise, very flexible. I didn't find any problem. And regarding the communication with Dr. Cheema. If you have more than one question, million question, he is happy to give the answer. Every visit I have more than 50-60 questions. He answered me very well, professionally and personally as well. Whole procedure was done perfectly. So when he was putting the implants, there was no any single pain. I was eating the food properly. He done the full mouth 2 weeks ago. He fixed all the teeth, no any pain, no any problem. I'm eating perfectly, speaking perfectly. Even my family is very happy because of teeth are very important for your life, because if you can't eat, your food go as it is, whatever you're chewing, then it causes infection in your stomach. So I really appreciate, and I'm really thankful to Dr. Cheema and Mrs. Cheema as well. So because they consult each other very perfectly, professionally, and they never leave each other. They use guidelines and they never bother like it costs them, but they always check the quality of the people, like quality of the patient, so that there will be no any issue. So I will request to the people, if you really want to enjoy your food and if you have few teeth, come to Dr. Cheema in Jalandhar and enjoy your rest of life with your family. In addition, I want to say this is the health job and I'm working health department in Australia, and when I check everything, then I decided to go with Dr. Cheema. I have done 12 dental implants, 6 upper and 6 down. Very good results and pure professional, and a lot of doctors give me a lot of cards which is showing the standardizing of the companies, like multinational company as well. I'm really happy with this top class doctor choose for me. I'm really thankful to Dr. Cheema and the staff member.
Hello sir, how are you?
Hello, good.
Feeling good?
Oh yeah, I'm really
feeling
good.
Happy?
Very happy, excellent, yeah.
After getting the dental implants treatment done from our office?
Yeah, I'm really happy. My family is happy. Even my kids are very happy because of the wonderful job, very professional job, and by following all the guidelines of dental.
Sir, you decided to get premium version dental implant.
Yes.
And are you happy with the results? And have you read about it or searched about, and are you satisfied with the product and the professional value which we gave with the implant?
Yes, I am really happy, and you also explained me all the things. Secondly, I have done the research with my other family dentists as well. It is really a good product and good quality, and it's natural as well. Yeah.
So no problem with eating, chewing and smiling, everything is
there's no any problem.
Yeah, everything is looking good.
Yeah, I can eat, I can chew, very good. I feel like it's natural. I'm feeling very natural. I'm not feeling any pain. Everything is normal as it is.
So we extracted your remaining natural teeth which were not in very good shape, and we placed 12 implants total.
Yes.
6 in upper jaw, 6 in lower jaw.
Yes.
So you can say all on 6 in upper jaw, all on 6 in lower jaw.
Yes.
And permanent teeth. So all done in only one visit to India and only in few days.
Yes. First day he done cbct, and next day he started the procedure, and it was very quick.
It is immediate loading. Usually doctors say that you need to wait for 3 months before you get the permanent fixed teeth onto the implants.
Yeah.
But we did it immediately.
Yes.
So no need of waiting. So no need of getting another trip to India.
Yeah, no.
So only in one visit everything is done, and with the permanent structure need not to come again.
No. Only one visit is enough, and he has a very good arrangements here, and you don't need to worry about that, like what you have to have. He will manage everything. In addition, I want to add one more thing. When I have seen one dentist in Australia, he told me no one can put the fixed implant in your jaw because you need a dentures only. Now I'm going back. I want to show him. This is a permanent implant done by Dr. Cheema.
Oh.
Yeah,
that was his words.
Yeah, he told me not possible, only denture. But I was really shocked. But after that, I started searching. I saw Dr. Cheema on YouTube, see the reviews, read the reviews, contacted Dr. Cheema, and he sent me a lot of video. He is very flexible. You can contact anytime. Staff is very flexible. You can contact anytime, and the main communication is good. And I make appointment. When I came here, next day I came to Dr. Cheema, and we have a consultation 1 hour. Then all the procedure was done less than 3 to 4 weeks.
I think I answered all your queries.
Yes, he's a very good professionally and personally. If you have a technical medical question and he has a good knowledge, he will give you a right answer. And the other thing, like the other doctors, sometimes not doctors, the other professional as well, like they call you back, when are you coming? He never calls. It's up to you. It's depending on the patient whether you want to come or not, because of he uses his knowledge, skills and qualification, because his work is very professional. He never follow up like when are you coming? No, he didn't call me. Staff member didn't call me. It's my decision. I choose him. him, and that's why I'm very happy, really appreciate.
After we placed your implants, my staff and we called you regarding the concern that are you happy? Is there any discomfort or do you need any advice?
Yeah, every visit when I was coming and after my procedure, staff called me even later on night, 10:30, 11 o'clock, how you feeling? And they give me advice, what you have to do, what medication you have to take it.
Because on that day, the surgery was done late evening.
Yes.
Maybe we finished up to 7 p.m.
Yes.
So they follow up.
Until 11.
Yeah, definitely. It is their duty to follow up.
Yeah, I feel like I observe just like I'm in overseas because they do nice follow-up. Normally doctors never do this. Yeah, and my family really surprised, like they are very more like worry about your procedure. I say yes, that's why I choose Dr. Cheema.
So sir, it was painless, no infection, no swelling. I think everything was well. Usually the patients query that will I get any swelling on my face or any infection after the implants, because there are a lot of myths, or maybe some patients have got the implant done from other dentists and they got bad experience with those treatment or implant procedures. Because usually patients come in and ask me, doctor, will I get swelling on my face or any kind of infection? What are the chances of infection? So any problem after I get the implants done, or any pain when you put on the permanent teeth, because this is the immediate procedure. So how is it possible that I'll not have any pain while chewing? So these are the journal queries, frequently asked questions by my patients.
When you follow infection control policy guideline which Dr. Cheema and staff member followed, it doesn't mean like the doctors create the infection. For example, in my case, my teeth were really infected. That is the main part. And when he took out my teeth, there were a lot of infection and he put me on some medication. Everything was clean. I didn't find any infection. I didn't find any swelling. I didn't find any like a different taste on my tongue when I was eating the food. Sometimes like after cleaning, anything like that, some materials like, you know, people feel different taste. No, I feel natural. When he was putting implants, I was going home and I was eating the food. My mom was really surprised. How are you eating? Because you're coming from the doctor. I said, yes. It's no.
Immediately after the surgery?
Immediately after the surgery. So even after first quarter, and I was eating, second quarter, eating, third, fourth, no any problem. My tongue was normal in behavior, no any issue. But also it depends on you as well, because the doctor gives the surgery, doctor clean everything, staff follow up. And if you eat stuff not clean, definitely the infection will be there. And that's not doctor responsibility, that's patient responsibility. Because in the clinic, they follow infection control policy, they give you advice on basis of that. But after that, you have to follow up, like cleaning, how to clean. He gave me very good technique, how to clean, what equipment you have to use, how to use the brush, right? Everything is compatible, no any single infection, no. And also the other thing, it is dependent on your medical condition, like if you have a blood pressure or diabetes. In my case, I have a blood pressure, my blood pressure was high and then it's come down. He advised me, no, it was really a great experience. Basically, I observed he followed the right way procedure.
But there was no complication, even though you have raised blood pressure sometimes, and
no complication, no extra bleeding.
Everything went perfectly well.
Yes, yeah, everything was good, no any pain, no any infection, no any complication. I can sleep easily in the night without any pain. But in addition, like whatever the regular medication, you have to take it once and paracetamol.
Absolutely.
According to the doctor advice. I have seen I have discussed with more than 40-50 doctors. 40-50 dentists. My family members are dentists.
Very much worried. Yeah. Okay, your family members are dentists.
Yeah. So I discussed with them. Then finally, I discussed in my family with even my kids, 11 and 8-year-old. They always told me, Dad, when are you gonna go to Dr. Cheema? They're really happy, you know, and because they know, because every time I was watching Dr. Cheema's videos on YouTube, and my family are pushing, when are you going? When are you going? So, and very flexible appointments, very flexible visits. The best thing I observe here is a family environment. When they use the professional, you have to be professional. I remember one time he told to his wife, you have to do this way. I was really surprised because of wife, you know. But when you work on surgery in a team, regardless of your staff family member.
She's also an implantologist. We both perform surgery, my wife and I. She's also implantologist, me too. And usually we try to perform the surgery together.
Yeah, they consult each other and they make a final plan. It's good, like you can talk the team. All the staff are very perfect, very mannerful as well. And they look after very well. So at the end, I want to tell people, like, money is nothing, health is most important.
Absolutely.
So when you will get, if you spend the money with other cheap doctors, if the result's not good, then you will lose a lot of things. So don't think about the money. Money will come all the time in your life, but health will come only one time. So go and check, review, and come back to the Dr. Cheema, and then you will get a nice smile.
And sir, moreover, what we do when we get a CT scan done, cbct, so we plan it on a 3D implant planning software,
which is wonderful. Oh, really?
That is not a software that comes with the cbct CD.
Yeah.
So that is a different, that is a cbct machines software. So usually dentists use that, but we use professional software, 3D implant planning. That is 3D implant planning software, and we do all in 3D surgery, everything in 3D.
Yeah.
So that is the reason we use every micron of the bone available in the patient's jaw, and we try to place the implants and immediate loading, and everything is possible with that only.
Yes.
So because we use very high-end tools with the high-end software, everything. So that is the reason we get the proper success.
3D scan is the main benefit, best benefit, less restrictive. Doctor can see the level of the bone. Doctor can see the nerves, your nervous system, where the nerves are going, and also the doctor can see your sinus, which is a very important part of your life, of your body as well.
Absolutely.
So
all the vital structures of the jaw, all are visible properly in the CT.
Yeah.
So we take care of all the vital structures while placing the implant.
One of the dentists told me they can do like 8 or 9 implants in upper jaw. When Dr. Cheema has done the 3D scan and using the software, and we found my upper jaw bone was very low as compared to lower one, but he done a very good job, and I was really surprised when the dentist was telling me your upper bone is not good, but he done a very good job. I'm really appreciate. When he was doing the surgery, his TV screen is on, he was looking at single implants, what is the level, where is the implants, perfectly.
All under 3D surgery, all 3D surgery.
Sometimes people like maybe can feel like it's a money wise. No, quality is better than money.
So patient safety and patient care is main concern in our dental office.
Yes, exactly. Because of this is your main part of your body where you have to eat, where you have to smell, where you have to taste. So if these are nothing, then you can't taste, you can't eat properly, you know. Looking wise, it's very hard to sit in the public without, if your teeth are not good.
Absolutely, sir.
Yeah.
Socially, it's very difficult to move.
You will feel socially isolated because if you will sit on these people, maybe they can see your teeth and see your impression is more important. And also I will thankful to Mrs. Cheema as well. So she done the wonderful job and all the time perfectly. And I was very surprised. Whatever the time give me, they start that the process. Yeah. And during my treatment time, I have seen a lot of patients, they were from overseas. They give me very good feedback. And I think 2 days ago, I had met one gentleman, he was from UK, London. He gave very good review as well because Dr. Cheema has done a good job. And if you will see his YouTube video reviews, most of the people coming from overseas, no doubt they are local as well. And even when my family has seen the procedure, my sister, she also wanted to do 2 implants from Dr. Cheema, and my brother's wife as well. And my 2 friends, one is from Pakistan and one is from India, but they are in Australia. So they are waiting for me when I will go there. So they are planning to come here.
They want to check the results before they visit.
But I already give the feedback. So now they are telling they want to see me face to face, and maybe they will come end of this year. Yeah.
Definitely, sir. We will do our best for them. If they are planning to visit, no problem at all. They are most welcome anytime.
I was really in doubt with 2-3 dentists, but my family, finally, before flying to India, I had this meeting with my friend. His wife is a dentist. We discussed everything, discussed 3 dentist profiles. We were really finalized with Dr. Cheema. My daughter came, she's 11, she said, Dad, you don't need to go anywhere, you have to go to Dr. Cheema. So now they are very happy. We shortlisted 3 dentists, yeah.
Right, sir.
Yeah, but my children, they know a lot of things, you know. They always watch with me. Then finally they asked me, did you choose Dr. Cheema? I said, yes, they're good. Yeah. It was very professional discussion in Australia before moving here. It's not an easy game, it's a big game, but your findings, your decision is most important. Yeah.
Yes. Absolutely.
Yeah.
A lot of cost is involved, surgery
cost
is involved.
Will come back.
Yeah.
Cost will come back when you will smile in public.
Absolutely, sir.
Yeah.
When you are able to chew the food properly, you will not eat junk, you will eat healthy food.
Yes, you have to stop junk food first of all and eat salad, other stuff as well, fruit and vegetables as well. And doctor did his good job. After that, you are responsible to look after because you have to do cleaning brush properly and everything, infection control, regular brush and eat properly.
Usually patients switch to junk food because they don't have the chewing area. So the salad is hard, the fruits are hard. So it's not possible to chew fruits and fruit properly if the tooth are shaky or maybe the teeth are not in good shape, they are sensitive or painful. So that is the reason patients shift to soft food or maybe junk food. So then the body is suffering.
With junk food you will get obesity. Due to obesity you will get medical issues like diabetes, blood pressure, and which affect on your teeth. Diabetes cause a lot of cause in your teeth. And in addition, like surgery sometimes it's hard if your diabetes is not controlled or blood pressure is not controlled.
Sir, we recently did a patient. His review is already on the YouTube. He was 88 years old from UK. The dentist over there told him that it's not possible in your case to provide you the implants and the permanent structure. And his wife got the treatment from me 13 years back. Then he talked to me over the WhatsApp and phone call, and then he came here and we did fixed structure for him. And he was a diabetic as well as hypertensive and 88 years old.
I have seen his video, yeah.
And successfully done. And I have talked to him recently on the phone, maybe few days back. He's very happy.
I have seen his video, yeah. I have seen his video.
So at the age of 88 years old, we extracted all the teeth in his lower jaw and placed 6 implants and permanent fixed structure in the lower jaw.
Yeah.
And we did one up in the upper jaw. There was a missing tooth and we replaced that in the upper jaw. Rest of his upper jaw teeth were fine. Mr. Tarsaim Gill from UK, male 88 years old. Diabetes is not a problem, sir.
Yeah.
Hypertension is not a problem. So we will take care of everything.
Yeah.
So we just want patient to follow the proper guidelines, control the diabetes, keep check to diabetes, keep check to hypertension.
Yeah, that is a discharge plan.
Yeah.
What after treatment done, then this is a discharge plan. You have to continue regularly brushing, proper medication, properly manage your diabetes, regularly check the heart specialist or diabetes doctor to maintain your body prostate.
Absolutely.
Yeah. So now I can eat easily apple, dry fruit. So initially I feel bad because of when I was in Australia, my front teeth was loose and out. I was covering with a mask and like doesn't look nice if you go in a group or in the staff.
Now no need to wear the mask.
No,
No
I
need
can
to
go
wear
in
the
my
mask.
staff easily.
Yeah.
I really appreciate it. My children, my family is very happy. My mother is very happy.
And you are going back?
I'm going back tomorrow.
That's
Yeah.
great, sir.
Today I just came here to say thanks to the Dr. Cheema and his
Thanks a lot,
staff
sir.
member
Thank
and
you,
wife.
sir.
Thank you very much.
Thank
You've
you,
done a
sir.
wonderful job
Thank you,
and
sir.
thank you very much. Good luck with the other patients as well.
Thank you, sir.
Yeah, and at the end, so I just want to say, in addition, like, he's very religious person, God religious person. He done his job, plus God done a lot of things, you know, that you will never get in other doctors. I have seen, he's very religious.
And sir, we only perform.
Yeah.
And
he gives
the
us
results
that.
are in his hand.
His hand, yeah.
Almighty.
Yeah, yeah. Very quiet place, and you can come and during the procedure, you can hear the Gurwani part as well, which will make you very peaceful and very relaxed. Thank you very much.
Thank you, sir. Thank you.
Thank you.
Thanks a lot.
Thank you. First